I felt a lot of shame. Hearing a doctor say that I need to take medication made me feel like I was failing as a mother. It made me feel like I was struggling, and me taking medication would be admitting to that. So I kind of chose to suffer in silence. Hi, my name is Taja, and I was diagnosed with postpartum depression. I have 2 children. I have 2 beautiful girls. They are age 2 and age 9. I experienced postpartum depression during my first pregnancy, and during my second pregnancy, I experienced postpartum anxiety, which falls under the perinatal mood disorder umbrella. I lost my 11-year-old sister about a week after I found out that I was pregnant, so I actually experienced prenatal depression, and those symptoms kind of lingered on into the postpartum period. My postpartum depression lasted for about 4 months.
So postpartum depression, it's very important to understand it is a medical condition, and it is a conglomerate of symptoms that occur after childbirth. It can include sadness, tiredness, appetite changes, whether a loss of appetite or increase in appetite, tiredness, and just an inability to achieve daily activities. Also, there could be a loss of sleeping and also cognitive impairment. And so it really impairs one's ability to carry out their daily activities. There is a distinction between baby blues and postpartum depression. And typically baby blues, which can be sadness, tiredness, and impairment in function, that can come 2 to 3 days after giving birth. And it usually lasts between 1 to 2 weeks. That differs from postpartum depression, which then actually lasts longer than 1 to 2 weeks and actually impairs one's ability to have their daily activities. So when we talk about postpartum depression, we have to understand it's an internal force of the mother and the birthing person. This is something that they cannot control.
One of the symptoms that I experienced was a loss of appetite. I wasn't able to eat, and I lost maybe over 10 pounds during the time of my pregnancy and during the postpartum period. I had severe mood swings, irritability. I had a loss of interest in things that I once used to enjoy. I'm a very social person, love interacting and talking with people, but during this period, I was just so sad. I was experiencing so much hopelessness. I really didn't enjoy being around family. And I remembered having so many visitors when my daughter came home from the hospital and just dreading every time someone would come visit me, because that meant that I had to put on this mask and pretend that I was okay when I really wasn't okay. Another symptom that I experienced was sleep disturbances. Having multiple interrupted periods of sleep throughout the night, not being able to get 8 hours of sleep, of course, with the newborn, and that kind of tied into those feelings of irritability that I would experience on a day-to-day basis. I realized that it was time to see a doctor during a time when I had a meltdown. My daughter had colic, so she was crying excessively, and I had a total meltdown, and I cried for what felt like hours. And that's when I noticed that something isn't right. I think for the most part, I kind of thought that the things that I was going through were pretty normal as a mom, but something about the crying just didn't sit right with me. So that's when I shared this experience with my doctor. I told him about some of the other experiences that I was having, and that's when he told me that he felt like I had postpartum depression. So once I shared these experiences with my doctor, he kind of suggested me getting professional help, seeing a therapist, and going on some antidepressants. And I felt a lot of shame. Hearing a doctor say that I need to take medication made me feel like I was failing as a mother. It made me feel like I was struggling, and me taking medication would be admitting to that. So I kind of chose to suffer in silence. I didn't go on the medication. I didn't seek professional help. I didn't even tell my friends and my family what I was going through, because I was afraid of the judgment that I would get from my family, the judgment that I would get from my friends. And I've never heard anyone around me speak about postpartum depression, so not really having the language or the education about postpartum depression. What my vision of postpartum depression was, a mom who doesn't love her baby, or a mom who can't connect with her baby and wants to harm her baby or harm herself. And I didn't experience those things, but hearing that I need to take medication made me feel like, well, what's wrong with you? So I kind of opted to not take the medication, and I kind of suffered in silence.
Having the weight of motherhood on one's shoulders can really be burdensome. And so it may apply a pressure that makes our patients and make many birthing people feel that they can take on the world and they don't need help. And so having a diagnosis of postpartum depression, they feel that it may put put a stain on their ability to be a mother and how they are doing and if they are failing. And sometimes this is a self-perception, but we want to let patients know that if medicine is prescribed by your provider, it is okay to take that medicine. And it's okay that we may need additional help during this time. This is a very vulnerable time, but it's also a very important time that you bond with your baby, and those early moments are crucial to their development as well.
What helped me getting through my depression was actually going back to work. Becoming a mom, especially a first-time mom, everything changes. Your dynamics with your family changes, your dynamics with your friends change, your dynamics inside your romantic relationship changes. And my only role became being a mom, and I had a loss of identity. But being able to go back to work gave me a sense of purpose again. And I felt like I was Taja, the social worker, and the mom, not just Taja, the mom. So that really gave me a sense of purpose again and really helped boost my mood and my self-esteem, and it kind of helped ease the depression.